You're listening to Jason Bolzano's article Obesity Crisis, the surprising link between weight loss and economic growth. We're going to dive into one of the biggest issues of our time, excess weight. We exercise and diet, but often don't see the results we're looking for. It's a problem that almost everyone is familiar with. We hear complaints about it all the time. But what if there was a quick and easy solution, like a magic shot or pill? A solution that could help us shed all our excess weight without too much effort? If you're interested in this topic, this video could be really helpful for you and those around you. On top of that, this isn't just about personal health, it's got some pretty big economic implications, too. Today, we're going to look at how governments are trying to boost their economies by helping their citizens lose weight. In Western countries, it's really important to have preventive health policies in place. One key part of these policies is to get people moving. Lots of tests and studies have shown that exercise can help to reduce the risk of disease. The more exercise you get, the less likely you are to get sick. But another important part of the equation is reduced healthcare costs and a stronger economy. A healthy population means a productive economy. In the U.S., illness and injury cost the economy about $575 billion a year in lost productivity. Just the cost of employees missing work adds up to $25.6 billion a year, or about $1,685 per employee. This also puts a strain on healthcare services. The U.S. spends over $800 billion a year on healthcare, while the UK spends around $250 billion. This means that as more people get sick, the economy and healthcare spending suffer. At this point, governments and employers see keeping their citizens and employees healthy as being in their own best interests. Building sports fields, walking paths, and swimming pools in every neighborhood is based on this logic. Similarly, anti-smoking campaigns were launched for the same reason, because smoking-related diseases have a big economic impact. The new epidemic of our time, obesity, has a similar impact. It's now widely accepted that obesity is a major contributing factor to many deadly diseases. In 2013, the American Medical Association said obesity is a disease, and the World Health Organization said it's a non-communicable chronic disease. Like smoking, obesity can lead to a number of serious health issues. Heart disease, diabetes, and high blood pressure are just a few of the conditions that can result from obesity. Excess weight can also disrupt hormone balance, affect internal organs and joint health, and may even contribute to mental health issues like depression. So, obesity affects not only our physical health but also our mental well-being. The economic impact of obesity is pretty significant. It leads to lost workdays, early retirement, more sick leave, and higher health insurance costs, all of which put a strain on economies. A study in the United States estimates that obesity costs the economy approximately $1.4 trillion annually, which is about 12% of the U.S. economy. Europe is also feeling the pinch from obesity. These effects aren't just felt in healthcare. They also have an impact on business and public finance. As a result, many governments and the pharmaceutical industry are working on developing new drugs to help people lose weight. If you're having trouble losing weight through exercise or diet, these medications could be a good option for you. Some medications used to treat obesity have really taken off in the United States. One of the most well-known of these is Ozempic, which has been really successful in helping people lose a lot of weight in a short period of time. However, these medications come at a high price. While doctors in the U.S. can prescribe them, the cost for those purchasing them privately can exceed $1,000 per month. Users typically lose between 5 to 15 kilograms, 11 to 33 pounds, within 1 to 2 months of use. But once they stop taking the medication, the weight tends to return, raising concerns about how long this treatment will last. The UK government is taking more advanced steps to combat obesity. The British government is investing in weight loss drugs as part of its plan to tackle obesity. The goal is to help people lose weight and improve economic productivity. The NHS in the UK sees obesity as a big health issue and is trying out new medications to tackle it. The British government is working with the American pharmaceutical company Eli Lilly to test new drugs like Tirzepatide for obesity treatment. This trial will look at more than just the health benefits of these drugs. It will also look at how they affect people's ability to work and their productivity. By looking at the economic impact of these weight loss treatments, the government plans to expand their use in the future. While obesity rates in the UK aren't as high as in the US, around a third of the adult population is classified as obese. This puts a big strain on the healthcare system. The UK is investing in weight loss treatments to reduce this burden and, at the same time, support economic growth. If this works, we'll not only see a drop in healthcare costs but also an uptick in workforce productivity. It's not just about public health when it comes to tackling obesity. It's also a key issue for economic and social policies. If countries can manage health issues well, they can also improve their economic efficiency. So, countries like the UK that are investing a lot in obesity prevention could see long-term economic benefits. In short, obesity isn't just a personal health issue. It's also a major economic concern for countries. The US, the UK, and others are turning to medication as part of the solution. These treatments could become more common in the future, playing a key role in reducing the global economic impact of obesity.